So, a very good afternoon to everybody present here. I am Pallavi Kamath, a first-year Masters in Hospital Administration student from Prasanna School of Public Health, MAHE Manipal, and I'm thrilled to welcome you all to the 17th International Health Literacy webinar hosted by the MHLU. So this session is tailored for healthcare providers, researchers, policymakers, industry professionals, academics, and the public, aiming to boost health literacy for a bright future and a healthier future. So before I introduce our speaker for the day, I have a brief request for all the participants. We kindly request you to mute your cell phones and the microphones and minimize any background noise that can arise from this. You can post any questions that you have in the chat box during the session, and we will address a few selected questions considering the time limits. Thank you. So in today's webinar, we will hear experts' insight on digital health literacy and technology readiness, the perspectives for implementation and planning of interventions in the digital health transformation. So ladies and gentlemen, please allow me to introduce to you our esteemed speaker for today, Professor Lars Kayser. He is a medical doctor and a board certified specialist in internal medicine with a particular interest in health informatics and health service innovations. His work builds on abundant experience, knowledge, and skills within both medicine, understanding the nature of diseases and how they impact individuals, as well as pedagogical and didactic training, working both with research, pre-graduate curriculum design and development, implementation and informatics, participating in several research projects focusing on how to transform healthcare services using technology. In the coming years, Lars Kaiser's research group will continue to work building on the experience, the epitel care model, and instruments to assess users' digital health literacy and technology readiness together with practitioners and clinicians nationally and internationally to inform, facilitate successful transitions and transformations of digitally enabled healthcare services. So now I would like to hand over the mic to Professor Lars so that he can take forward the session. Over to you, sir.
Thank you very much. It was very detailed introduction. I'm really looking forward for this webinar today and to meet you participating here. And I also hope we will have some time for discussions. What I'm going to present today is how we in our research here in University of Copenhagen in collaboration with Melbourne, Australia, Professor Osborne perceives concepts of health literacy, digital health literacy in particular, and give some insights and also hopefully put up to a discussion about how we could perceive these areas. The agenda for today is I'll first very shortly touch upon health literacy, just to remind all what it's about and how it may interlink with digital health literacy. And then I'll go into the understanding of digital health literacy, technology readiness, and then I'll go into how to assess it, and then the clinical implications. So that's the short agenda. So the first part here is the basis about the health literacy. And as you know, as I think many of you are experts already in health literacy, there's a lot of definitions, but one of the first definitions is one I would like to in particular call your attention to, and it is the one from WHO in the 90s. And the important thing here is that it is about cognitive and social skills, which determines the motivation and ability. And it's important to notice this. I know there are many other definitions today, and also broader, involving the individual in relation to the organizational part. But when we are going to discuss digital health literacy a little later, then it is very important to note here that skills is one of the things discussed, and we'll come back to that. Is it skills? Is it knowledge? Is it competence? And also here is underlined is ability and motivation, and it's also a social component, and that's important for health literacy, as it is sometimes forgotten when we talk about digital health literacy. And that's one of the things I want to emphasize today, is that we still, when we discuss technology readiness and digital health literacy, we need to be aware about these key concepts in health literacy. And another thing I would like to call your attention to is that when we talk about health literacy, there's an abundant literature showing that health literacy is a determinant for many things. People with low health literacy, they have less compliance with prophylactic programs. They do not participate in vaccination screening. They have more contacts to the healthcare, more unplanned contacts, and they also have a lower average lifespan. So it is a real huge determinant when we talk about health literacy. Interestingly, the literature about digital health literacy is not that abundant, and it's not clear to what extent actually that the digital health literacy have the same role as a determinant. I know there's some literature out here during the last 2-3 years, but I do not think it's very convincing with respect to the importance of digital health literacy as a determinant. So that's something I also would like to discuss with you today or later. So also, if we don't have the time today for discussions fully, then you are always welcome to approach me afterwards. Here I just have some data from a Danish study with 17,000 informants that responded, 34,000 were invited, and it's still again about health literacy. What we used here was the health literacy questionnaire, which has 9 dimensions. We used 3 of these dimensions in this survey. And the reason I take it here is it links again to discussions about how can the digital components, how can the digital health and digital tools maybe help us in the interaction to increase health literacy. And very short, the instrument here has these 9 dimensions, and here we have picked 3. One is about the interaction with the health professionals. One is whether individuals feel they have sufficient information to manage their health, and the last one is that they feel that they understand the health information well enough to handle their conditions. And what is interesting here is that we have combined this investigation also with some digital health literacy scales I will come back to. But what you can see is that the informants here, they have a low number. They have actually more than 1/3 have an insufficient level in relation to feeling understood and supported by health professionals. And it means that 1/3, and interestingly, it's an overweight of younger people that actually does not feel understood by the health professionals, and particularly younger people. And the other way around is that many people, more than 80%, more than 4 out of 5, actually feel that they have enough information to manage their health and also to understand how to handle their condition. But for the last one, it's interesting that with age, the number of people having sufficient level in the MHLU9 domain or dimension decrease with age. And it means that older people actually have problems in relation, and it's probably due to having multimorbidity and more complex situations. So when we later on today is going to discuss where can the digital health actually help, then we could suppose, and I'll come back to that, that for the younger age groups that use technology more, we could use digital health to support how they feel safe, how they feel supported by the health professionals, where it will be difficult for the older people. I hope it's not too confusing what I'm saying now, but it's just to bring into your mind that there is one kind of ability to use the digital tools and digital health in relation to health literacy, and it may also be a barrier. And I'll come back to that and show some data that supports both positions. So now I'll go to what you are looking for learning about today. That's the digital context. And I run very fast through this, as many of you already know the story. As in the mid-zeros, we had an increase in digitalization. We began to have communication using computers. We also began to have screen consultations and involve web portals, and in particular websites. And it's the same time as social media came, at the same time as smartphones came. So it's just to recall that it was almost 20 years ago, where it was a very immature way that we work, but we introduced a lot of digital tools. And in this area, two Canadians, Norman and Skinner, that many of you probably know, introduced the definition of e-health literacy, later called digital health literacy, and what they used to develop their concept of e-health literacy was communication and interaction with college students. And they ended up with this definition here, which is very similar to the one presented with health literacy. But what you should note here is motivation is not here, and skills are not mentioned. Cognitive and social skills are not mentioned. It's about the ability to find and access and use information, to using technology to solve a certain health problem. So it's a very narrow definition. They also developed a questionnaire that has been used in many studies, and the way they conceptualized the understanding of e-health literacy or digital health literacy is the Lilly model here that many of you probably know. And the interesting part is it contains 6 kinds of literacies. So again, a literacy is a skill. So here we come back to skills. It's actually about skills here. It's about health literacy. It's about traditional literacy by reading, calculating. It's about computer literacy. And then it's about media literacy, information literacy, and science literacy. What you should note here is, in particular, the areas, domains in their model about the traditional literacy, the computer literacy, and health literacy part, as that comes into other models I will present today. In relation to the definition and understanding by Norman and Skinner, there has been a lot of studies using the e-health, which is an 8-item instrument. And what is in the literature, and it's almost the responses to the individual items, is if you have score low, then you will say, we can see that it's difficult for you to see how reliable a source is. It's also a problem to understand how to get the information, and also you can be in doubt about, you can have difficulties in communicating or trusting information from the health professionals when technology is used. On the other hand, the newer literature points into if people have a higher level of e-health literacy measured with e-health, then they will be better to participate in shared decision making, and they will probably also have a higher level of well-being. That's what the literature points into. You can read more in the reference here. What happened in the 10s and up here in the 20s is that the healthcare around the world has developed into being a mesh-like structure where different actors, health professionals, general practitioners, specialists in hospitals, allied health professionals, alternative therapeutics are coupled up in this mesh-like structure. And we use more and more technologies to communicate both between the health professionals, but in particular also with the patients and their relatives. So we come into this more social technique structure, and that called for up in the 10s for an alternative to Norman and Skinner's model, and in particular the e-health. And in response to that, there has come out a lot of definitions here during the last 10 years, and also measures I'll come back to. One that we here in University of Copenhagen, together with Professor Richard Osborne, at that time Deakin, today in Swinburne at Melbourne, Ole Nørgaard, together with Richard Osborne, developed this e-health literacy framework. And the idea here was that he had conversations with a lot of actors around in Denmark and also in UK, and later on also web consultations, and it was with a focus on what is necessary to be able to handle your condition using digital means. And what was developed or turned out was this e-health literacy framework, which is 7 dimensions that also today exist as 7 scales as an instrument. And the first 3 in the bottom is very much like the same as you can see from Norman and Skinner's model. It's about health literacy in dimension 2. It's about being able to use computer to access digital services, the computer literacy, and it's also the ability to find information, which is very similar to the traditional literacy. And then there came in new facets, which is the motivation. Here, the motivations comes up. It should benefit. It should be of advantage. And then it's also that you feel safe in control, that you trust the data that you give to professionals and that are in the systems are handled correctly. And then very interesting from more structural and structural and cross-disciplinary, cross-sectoral approach. We have these systems that work in the domain 6, which is very much about that data available for everyone at the time they need it. So it's about how the health professionals from different sectors can access the same data together with the patient and their relatives when they need it, wherever they are. And then the 7th dimension, which is about the usability. So that's the new understanding we proposed in 2015 of what is digital health literacy. And it has some similarities with the model of Norman and Skinner, but it has this expansion about motivation and about how data are shared across different disciplines, and also the trust in the data. This new understanding has led us to propose a new definition. It's only a proposal. It's not published, and it's very much open for discussion. But the idea here is to come back to the ability and motivation, and then it's about ability and motivation to find and use, evaluate, and use data, access, evaluate, use data, health information from digital sources. So here we have the key features from our model, which is about this ability to find information using digital structures. And then we have also added the other part, which is about communicating in confidence or in trust, which is that you feel safe and secure with respect to your data. And then it's synchronous and asynchronous communication and interaction using digital means, digital tools and services. So with this new way to describe it, we have expanded a little on what the understanding of digital health literacy should be when it is understood as we have in the health literacy framework. So it's just a proposal and it's open for discussion. But I think it's very important, and many of you will probably realize it, that we have both the synchronous and asynchronous communication, and it's very much about information rather than data. Yeah, so then I will just add to this model of the e-health literacy framework, as we were informed in the mid-10s when we developed the health literacy framework, that from Gilstad, which is a Norwegian researcher, that it's important to have a cultural and social context. And that led us to expand on the e-health literacy framework with some domains or dimensions from Professor Osborne's health literacy questionnaire or dimensions, and also from his health education impact questionnaire. So what we added into this understanding of digital health literacy, we added based on experiences from the the literature, 2 dimensions, which is the one about feeling supported and understood by the health professionals, and then also about having a social network in relation to your health. So it's the social capital, and then it's 4 dimensions, which is about how your condition impacts you. So it's if you have emotional distress, then you will experience that it may be more difficult for you to use technologies, as your condition will actually impose a burden on you. So your interest in digital solution is less. So that's why we added these 2 dimensions about distress and the attitude. And then we also added about self-monitoring insights and technique, skills, and acquisition. And it's not about technology. It's not about monitoring using technology, but it's about insights. It's about how you understand your body and how you understand what is going on, and you're able to manage your condition. So it's very much about self-management. So we proposed this model in 2019 as an expansion of the e-health literacy framework and have used that both for qualitative and quantitative studies. So now I come to the assessment. And the assessment part here, first I will acknowledge that there is a lot of tools in the literature from all over the world. There's from Europe, there's from Taiwan, there's from South Korea, there's from USA. Some of the definitions and some of the instruments are based on definitions and also concepts, but it's just to say there is a lot of different approaches to how to measure, how to define, and how to conceptualize digital health literacy. So there's not one common understanding. So what I'm presenting today is our understanding, but also recognizing and acknowledging that we are not the only ones in the world, and we do not necessarily have the patent on the truth. But we think that the way we work with our definition, or rather our framework and our instruments, that we have a more social, technical system or ecosystem that actually can help to inform in different ways, as I will illustrate later. And what we have in our universe is that we have developed the e-health literacy assessment toolkit, which I'll shortly present, which is a toolkit to measure health literacy and digital literacy. So it's a combination of these 2 literacies. And then we have the EHLQ, e-health literacy questionnaire, which is based on the e-health literacy framework. Then we have the staff EHLQ, which is an expansion of the e-health literacy questionnaire aimed at measuring how health professionals perceive the way they interact with their patients. And then we have the READY instrument, which is an instrument with 65 items based on the READY I showed just before. And then we have a new single item that we right now call Screen It. It's only one question, which is informed by Dreyfus and Dreyfus, novice to expert thinking. And I'll come back to that, as we think it could be used in some context as a screening instrument. And there will actually come out a publication next month, maybe already next week, in JMIR Aging, where we have combined data from READY and data from Screen It, together with social demographic data in older patients in Norway. So you can read more about this new tool, Screen It. It was also published in relation to our study with staff EHLQ in 22. That's the reference here. The e-health literacy assessment toolkit is actually of interest from the perspective that it looks into 4 dimensions of health literacy, and then it looks into 3 dimensions of digital literacy. And we developed it in parallel to the EHLQ, as we recognize that in some situations it would be very helpful. And it is actually linked to the 3 basic basic parts of the health literacy framework and the motivation. So it's about the ability to find information or using technology to find information and the conceptual language and concepts and language, and also the ability to use digital services, and then the motivation part, which is embedded in this ELA. And the 4 instruments for health literacy are inspired, or scales from health literacy, inspired by TOEFL, the test of functional health literacy, where we made a variant of that with only 10 items. And then it is a condensation of the European Health Literacy Survey, where we used 9 items from that. And then we had some questions about familiarity with terms. And then we had a little quiz knowledge about health. And the digital literacy part, it's about familiarity, confidence, and incentive or motivation. And we have a study in preprint right now submitted to JMA Human Factor. It's only in preprint as JMIR have not been able to find reviewers. So if any one of you listening here today would like to review it, then either send me an email or go into JMIR's homepage, Human Factor, and then sign up for reviewing it. But the interesting part here is when we have looked into the health literacy part and digital literacy part, that we can see in a population of approximately 900 patients, that 1/3, a little more than 1/3, have a high level or sufficient level of both health literacy and digital literacy. And what characterizes them are they are in the younger part of the population, and also more than half of them have a high education. And then, not surprisingly, 14% or about 1/7 of the participants had a low level or insufficient level in both health literacy and digital literacy. And maybe not surprising, maybe surprising that it's only about these 14%. And then we found a third profile, which is of interest, as it's also about 14%, or 1 out of 7, where they have a high or a sufficient level of health literacy, but a low level or insufficient level of digital literacy. And that's important from clinical perspective. It is when we look into populations that we have persons that have with the current situation, without digital tools, digital means, they're able to navigate in the information pamphlets and information from hospitals, clinics, pharmacies, in print. And what characterizes this group is that they are older, and also they have a low level of education. Most of them only have public school education. And then they have this digital literacy level. And it means if we do not address this 1 out of 7 persons, then we can risk that they will not be able to maintain a sufficient level of health literacy, and the digitalization may impose a threat to these people here. So that's a concern that we have raised, and we are trying to look a little more into how we can address that in the future. Yeah. The eHealth literacy questionnaire is almost the same as the eHealth literacy framework. If you look into the domain 1 and 2, you will see that the names have changed a little, but that's not important. But the important part here is that we have used 3 of these scales. We have used the scale 1 and scale 4 and scale 5 in the same study as I presented in the beginning of my talk. And what you can see here is that the uses of technology to find information and the motivation part, there we only we have 1/3 which have an insufficient level, or said the other way around, 2/3 have a sufficient level. But if you recall about the information part in the health literacy scales I presented in the beginning, you will see here that it's more people that are challenged here in this population with respect to the digital part than the health literacy part. So that's another concern, is when we introduce digital means and tools, it may, like the ELA study from another region in Denmark, indicate that it may be a problem, and in particular when you look into the age distribution, that those above the age of 65, then 40% have an insufficient level, and if you come above the age of 80, it's more than half that have an insufficient level of digital health literacy measured with scale 1 and 5. So it is important to be aware of the possible challenges in the digital world for people, and actually a risk of their level of health literacy can be challenged when we use more and more digital means for the communication. Another thing which is of interest is that the way to feel safe and control with data, the trust in how data is used, that we have 85% actually have a sufficient level. I find that it's sufficient the way the data are handled, and they understand how they're handled and confident. So it's not a problem, at least in this population, and we have seen that in more studies in Denmark and other countries, that in many countries the trust in how data is stored and used is not an issue for most in the population. So that's of interest as well. Yeah, and I'll not say much here. It's just if you get the presentation afterwards, you can go into these publications here and look into if there are particular facets you would like to look into. But we have looked into the uses of health portals. We have looked into pregnant women with migrant background, and we have looked into different other settings. So this is only literature from our group. There is an equivalent number of literature from Australia, from Professor Osborne's group, and there's also emerging more and more articles from other groups around the world, in particular in Europe right now. Sweden, Netherlands, Spain, Germany, Norway. So it's coming up, and much more to come. Right now we have more than 25 languages translations. So there will come a lot of literature. So if you're interested in looking into it, then search for EHLQ. And if you're interested in some of the rounded material, then you can search for our group, or if it's more for the validation parts, then Christina Cheng and Richard Osborne from Australia. I mentioned that we also have this adaptation with the staff EHLQ, where we change some of the items in the domains 4 to 7 to understand how the health professionals perceive the interaction with the patients. And we use that in relation to the implementation of a electronic health record in Denmark some years ago. And what we could see was that in relation to the first 3 dimensions, which is the personal skills, the medical doctor scored higher. We could also see that the motivation after the implementation of the e-health record system actually dropped, which was quite surprising, as we had anticipated it would raise. And then we could see that for the EHLQ1 using technology, for information, it is actually between 1/3 of the health professionals that have an insufficient level, 22 to 31%. And this was in particular those with lower education, medical secretaries and social assistants and nursing assistants. And what we could see after the implementation was that those having a higher age, they actually had a negative association, or there was a negative association between age and the scores in the first 4 scales that relates to the personal skills and the trust in data. So this study raises a concern that health professionals may be challenged they may experience anxiety or stress. That has also been published from another group from Manipal Health in Australia using e-hills. And it has also been raised in other relations that the technology may cause anxiety and stress that needs to be addressed to be successful when we implement new systems. So here it was quite useful to have this instrument. And this is just the ready part. And again, it's just, you can come back to the slides and look into it. But we have used the ready instrument both for cancer rehabilitation, inflammatory bowel disease, and also in ICD patients, and now also in older patients in Norway. So it's been used in a lot of different contexts, and other research groups from Denmark not affiliated with us have looked into hip fractures. I think it was an orthopedic study, and there's much more studies to come from around Europe, around the ready instrument. Yeah, then I'll go into some discussion of very short, some practical implications. And when we talk about how can we use all our tools for practical purposes, then we're talking about we can use it to understand the users in our clinical meeting. We can use either the instruments to measure, but we have also used it as conversation. And right now we are looking into, inspired by Richard Osborne's chat instrument for health literacy, to see whether we can make a similar chat instrument for e-health literacy or technology readiness. And we are also working with, and it's going to publish here within the next months, how text vignettes based on the scores in Ready can be used. So the Ready scores generates text vignettes that can be used in the interaction with patients, persons, people, and then we can understand them. We can use it in the onboarding process to understand what is going on there. We can use it in the monitoring and the design planning of new things. And here I will very shortly present a toolbox that we have proposed in the European Respiratory Society's monography in 2023, where I, together with Dr. Claus Paneret, which is a Danish doctor that has worked with telehealth and virtual wards for more than 15 years, he and I made 4 tools or 4 boxes for how to actually approach people in different situations. I will not go through it in details, but the first one here is just to mention that when you meet your patients in the everyday life, it's important that you involve technology. If you work in a digital environment, then meet with your patients around the screen, discuss the data, talk with them, try to understand what they understand, so you actually can work with them to understand the level of their health literacy, and also identify whether they have the resources to go back to it when they come home, or if you are in an area where they do not have the resources, whether you can provide some resources in your clinical practice, and also whether they have some in their family or social network that can support them in understanding their data. So in this everyday practice, it's not so much about the digital part or digital making people digital health literate, but it's about the health literacy component, that the digital component does not reduce the ability to understand data. And here we could recommend to also use the screened one item question here to understand the users, whether they feel confident or not. The second one here is when you want to introduce a technology, ask them to go home and monitor something, make electronic weight via Bluetooth, send some data, or introduce a glucose meter or whatever. Here it's important to understand what they understand in relation to technology, what are their experiences, prior experiences with technology, and ask them about what they think about it. Also create a meaning and impact relevance. It's very important when you introduce the technology that's both relevant and impact meaning is introduced. And here we propose that you use the ELVC framework as a template for having the conversations, little chat-like, to address how confident they feel about how the data is used. Are they motivated? What are their experiences with using technology for managing information, and what are their experiences in relation to computers? So here we recommend to involve the thinking about digital health literacy. The third layer is when you introduce a telehealth service, then it's very important that you have a sustainable adoption, and you will keep the patients or individuals with you for long periods. So here we recommend that you measure the level of digital health literacy and follow it over time, maybe repeat it after half a year, 1 year. And also that you involve your patients, you make them make logbooks, you get inputs, you invite them to give feedback, and you actually try to make them get a buy-in and be active, so they also will become active in relation to become more self-managed or have larger capability for self-management. So there are some suggestions here, but we are here scaling up, involving more, and trying to get this more, making a joint effort, a collaborative effort, as it's very important if you want to keep people for longer periods in telehealth solutions, to keep them interested and keep their meaning and relevance in the setting, and also learn from your patients. And the last one here is when you're going to make the implementations in your organization. Here we recommend that you address individuals, healthcare professionals, potential anxiety, stress. And we have also recently seen in a new study that the roles of, in particular, nurses and their identity can also be challenged. They can be challenged with respect to their competence, increasing this feeling of anxiety and stress. So it's very important in your planning that you involve healthcare professionals, and you have an open environment where it's allowed for the healthcare professionals to say, we are worried, or we do not think that it's the best to do for our patients, or we are not sure that we have the competence. So it's very important here to work from an open perspective, and maybe use the staff MHLU at certain levels. But these 4 boxes here is just for inspiration. You can go back to the slides, or you can find them in the European Respiratory Society's monography. And then there should be time for some discussion.
Yes.
So I'm over now.
Yes, sir. So thank you so much, sir, for sharing your valuable insight on this topic. I'm pretty sure we all have something to think about and discuss about further. So now, without further ado, I would like to invite our moderator for the session, Dr. B. Reshmi. Dr. B. Reshmi is a distinguished academician, a researcher, and Associate Dean for Academics at the Manipal College of Health Professions, Manipal Academy of Higher Education. She oversees academics, student affairs, admissions, and branding, while also serving as a professor and the head of the Health Information Management Department. Her research focuses on health systems improvement, digital health, and public health in resource constrained settings, with projects funded by organizations like ICMR, WHO, DFID, etc. She has led studies on hospital quality standards, cancer registries, and health innovations for chronic disease management. She has also received numerous accolades, including Public Health Research Initiative Fellowship and a travel grant from ISPOR. She is a collaborator for Global Burden of Disease Project and an active member of professional organizations like ISPOR and the Asia Health Information Network. In her administrative role, she has been instrumental in curriculum development, institutional branding, and fostering educational connections for students from northeastern India. Dr. Reshmi's contributions to healthcare education and research have made her a respected leader in academic and public health. Over to you, ma'am.
Thank you for the kind introduction. I thank you, Professor Kayser, for that very comprehensive, session on this digital health literacy. I think we have a lot to learn from the way you have put across the different items and the different scales and toolkits that you have used to assess the digital health literacy among patients and also the healthcare professionals. Uh, we in a country like India, it's a very diverse country with probably the digital health literacy. The levels vary. It may vary. I mean, we probably have not introduced any or have not carried out any studies like how we have done. How effectively you have done in your country or maybe in the European countries. So I would keep some of my questions to the end, but I would first want to invite from the participants if they would like to put across any questions to you first for discussion and then followed by a wrapping up of the session. So participants, if you have any questions, if you can put it across so that Professor Kayser would be able to address those questions and then we can continue the discussion in those lines.
Yes, if you are unable to enter it on the chat, please feel free to raise your hand and we can call upon you, or else if there is not option, then you can definitely unmute yourself and ask the questions. Yes, Jai Bharti. I think he has a question. You can go ahead and unmute yourself.
Yes, am I audible? Yes,
Yes,
very
perfectly.
insightful talk, sir. I want to know, what do you think about the future of digital health literacy? I mean, people used to Google about their symptoms and whatever they need to know about healthcare, but these in this age they would just ask ChatGPT what they think and what their possible diagnosis could be. So, what do you think AI, this new age of information technology, would have impact on digital health literacy? Thank you, sir.
Yeah, I laugh as it's a very complicated question to answer. I think that for the first 2, 3, 4 years, when we have the different generative AI systems, then they will not be complete, and you experience every day that you will get some wrong answers in between, and sometimes they are set up in a way where they do not answer fully. So I think it's important that we still work with our patients' digital health literacy and have conversations, and like we have suggested here in the toolbox, to have conversations around the data, their clinical data. It may be also worthwhile as clinicians to have conversations with our patients around what they have got of information from the generative AI systems. But in the long run, 10 years, something like that, they will have a complete other role. But I think, and it comes also back to our moderator's comment, it is that people with lower educational level, people that are challenged from other reasons, they have a lower level of digital health literacy. And if we understand, by using these multidimensional instruments that we use, is it their motivation? Is it their understanding of the words and language? Is it their ability to understand how they get the information or how they use the computers? Then we can actually address where do they have the problems. As I do not see in the future that we'll have all people in a population, even in countries which are very digitalized, that all people actually will benefit from the Gen AIs, as there is such a diversity in how people live and approach different information sources. But it is speculative, so I don't know whether it helped you very much.
I think yeah. Yes, please go ahead. Hope you've been able to understand what I mean. Probably he has answered your questions.
Yes, sir. Thank you so much for the answer. That was very insightful. Thank you.
Yeah.
Can we have few more questions?
If there is any issue with the chat box, please feel free to unmute yourself and go ahead and ask the questions.
All of you as future healthcare leaders, I think it's very important that we try and understand how do we address those challenges in a country like India, and probably some more of the low and middle income countries. The challenges that we face here are very typical in nature and very diverse. So I would like to invite a few more questions.
Yeah, I myself have a question for Professor Lars. So, considering how digital health is something that's very new and that is coming to this generation now, there is also a group of people, also known as the older adults, who may or may not have access or knowledge to, have information about digital health literacy and all of its aspects. So, how can healthcare providers tailor digital health interventions to diverse populations, especially older adults or those that have lower education levels or those who are not so literate about using digital intervention or its services? So, how do you think we can address this issue?
Thank you very much. That's actually what is in these 4 toolboxes I presented. As what we have seen in our projects is that older people, even though we can see in these general population statistics, they have a low level of digital health literacy. If we meet them in our outpatient clinic or we meet them offering a telehealth service, then most of them can actually be onboarded when we know where are the problems, where is it due to lack of resources? Is it in an area where they do not have access to technology, or do they not have experience with technology? Who can be identified in their network? Is it children, grandchildren, or is it social care or voluntary helpers? And we have actually been able to onboard most of those we have met. Those we are not able to are those who are cognitively impaired, moderate or severe cognitive impaired. There are some situations where you actually can do it, but for somatic conditions you cannot. And then people, if they have drug and alcohol problems, then it can also be a problem. But that's the only 2 subpopulations we have had problems with in our work in different settings. And I feel, and I'm quite sure and confident that most people, if we approach them and understand them, and introduce the technology to them and ensure the resources are there, then we can also get the older people and even people up to 90 years plus on board. And that's also why on one of the text boxes wrote, do not go into ageism, as we have seen in a study that is published that the health professionals try to protect the older people and say, oh, they're not able to do it. And we have also seen that their children in the age of 60 years have tried to protect the older ones. So we should not have ageism, and we should really try to go into dialogues. And I'm not an advocate for measuring each time, but use our frameworks to organize conversations, and that's what we would like to look more into, how it can structure interviews. And we have also published some articles using Ready, where we have describe profiles, different profiles with different challenges, so the healthcare professionals actually can work with and look into what are the characteristics of different profiles, just as I shortly showed for the ELA.
All right. Thank you. Thank you so much for answering the question, sir.
Please, Anju.
There's one more question. Yeah, please go ahead.
Yes, Deepthi.
Yeah, so I wanted to ask, how can we enhance the adoption and penetration of digital health literacy across diverse population in India? And what do you think the strategies? What do you think about the strategies that we can implement to effectively reach and empower more people, especially in rural areas?
Thank you. I know India is a huge country. I can't recall the exact number, but it's something like 1.2 billion or 1.4 billion people. You have a lot of different states and regions, and you have real different areas with different maturity. But if we talk about the rural areas, then again, it's about meaning and relevance. So we need to introduce the different services or tools and means. So it's first when the resources are available, and I have actually learned that in many areas of India you are quite digitalized, but the first thing is that you need to plan for how to digitalize an area, how to expand on the digital health component, and then when the digital health component is going to be offered, then it is to work with people in the introduction and onboarding. So it's from a socio-technical perspective, you should look into it as an ecosystem that you're setting up, and where you introduce the different technologies, and in that way improves the digital health literacy. So we should not start by increasing digital health literacy by programs, but we should try to introduce what we would like to offer in the different settings, which are meaningful, whether it's smartphones, SMS in rural areas or whatever, and in that way involve people.
Thank you so much, Star. Thank you.
Professor Lars, okay. Are there any more questions?
I think there's one in the chat box.
Okay. I have not seen any. I am unable to see that, Amrita. So,
I can read it out if that's okay.
yeah, please read it out.
Yes, this question is from Anshuman. He said, "Thank you, sir, for sharing this knowledge." And his question is, how can we improve digital health literacy among frontline workers in LMICs? And what key differences exist compared to European countries? Yeah, that was the question.
Yeah. I'm just thinking for, again, the frontline workers, there are two different things. One is what is addressed a lot right now is how to use technology, which is how to use a screen for conversation, how to use different other things. And you have these technology courses in a lot of different settings, both from university colleges for health professionals and postgraduate teaching. But then we have another thing which is not about using the technologies, but is actually use the digital health to support people. And now I'm talking about people with chronic conditions. If we want to support them, it's very important that the health professionals are trained to have dialogues with their patients, where you focus on their whole day setting. What are their values, preferences, and needs? What are their goals? So it's the international movement. What matters to you? Is it important to go with a friend to a cafe or to some other social activity, or is it to have a visit from your family or play with your grandchildren? So it's very much about one part is to train for the digital part, but the other and more important thing in relation to chronic conditions is to train the staff to work with the patients remotely and understand what their needs, preferences, and values are.
Yes.
Thank you, Professor Lars, for answering. I think you have comprehensively covered all the areas where the questions have asked. So I don't have much left to ask, which I was also planning around the same lines. But in the context of India, what I feel is the mobile penetration is quite high as compared to maybe any other countries. Although we may have a little less literate population as compared to the 1.2 billion, and literacy levels may be around 60 to 70%. We may have, but then the mobile penetration is very high. So the digital application use may be very high, but how to convert it for you know improving the health seeking behavior, or improving the benefit, because we do have a system wherein there's a lot of load on the tertiary care. So how do we increase it more for the preventive health is something probably we should explore, and that could be one good research to collaborate and work with uh, in the context of India. And what do you say about that?
Yeah, that's the typical public health question, and the short answer is you need to work from a structural perspective. So it's very much about, if you want to go for some preventive measures in relation to preventing risk factors for chronic conditions, diet or alcohol or whatever, smoking, then you need to have some specific programs. And again, the digital part is just a
Means.
means for it. And the important thing here is to think about it. And when we talk about complex interventions, it is at the same time important to acknowledge and realize that when we want to use the technology as part of it, it is a separate layer we put in. So it is not only to put in the digital part into a complex intervention or a structured program, but it's also to recognize how the technology can be part of an ecosystem that is additional. And if you have some incentives in the mobile phone for certain age groups or certain apps, etc., then it's very much to think about how can we benefit from that. But I do not have a clear answer. All people struggle with this now, but my very important message here is that the digital part is not just a component of a complex intervention, but it is more than a component that has its own ecosystem premises, and you need to make some kind of logic map or other things addressing the digital part as well.
Yes, yes. Thank you so much for that insight, Dr. Lars. I think we can probably come to a close if there are no more questions. So I'm very thankful to you for having given us such an insight into that. To sum it up, you explained how we can actually effectively use AI to maybe increase health literacy. Yeah, okay. There is one question. Okay.
I think we had one of the international students raise their hands. They can go ahead and ask the question. Oh, I am unable to see who that was. So ma'am, you're on mute, ma'am.
So shall I just try and sum it up, or should we just wait for a few more questions? Yeah, okay,
Thank you.
So I think Professor Kayser has basically tried to sum up with respect to the questions also, how we can use AI effectively to be used, increasing the digital health literacy, and how do we use it for different populations, specifically the older adults and the populations, requiring special care, or maybe even, some of the caregivers, how we can incorporate digital health literacy to be because many of the patients who would need a caregiver, so those kind of population also we could, so, and how do we use it for a diverse population like India? More than anything else, there should be a social driver for all these, to be instilling the digital health literacy readiness among both the patient group, the population group, as well as the healthcare professionals. So maybe in India, we would probably have a little bit of resistance at times in, conveying this to the healthcare professionals as well. But we still are, trying that, and we are still uh, trying various ways how to improve this. But I'm sure we'll be able to come, as you mentioned, having an ecosystem for that, and initiating the readiness among both the groups, the professionals as well as the patient group. Probably we should have an effective ecosystem wherein we can drive this, and it really will be beneficial, for, and probably it will address a lot of public health issues that we have, when we initiate digital health literacy among our population. So that would very insightful session, Dr. Kayser. Happy that I could also be part of this, and thanks to MHLU also for the initiative and for inviting me to moderate. Thank you once again.
Yes. Thank you so much, ma'am, for moderating the session, and thank you, Professor Kayser, for patiently answering all the questions that were presented by the participants. I am pretty sure we do have something to take back and ponder upon, and see what we could do to address this digital health literacy in the Indian context. So the panel discussion has come to an end, and it is my honor to represent MHLU for such a fantastic event. I would like to extend my heartfelt gratitude to our esteemed speaker, Professor Lars Kayser, and our moderator, Dr. B. Reshmi, the faculty, staff, MAHE students, and the MHLU members. I would especially like to thank Dr. Cherian Verghese, the director of Prasanna School of Public Health, along with the MAHE Press and Media Administration for all the support that we have received from their end. While I may not have mentioned everyone by their name, it is my sincere thanks that goes to all who have contributed directly or indirectly to the success of this webinar. And last but not the least, I would like to thank the participants without which this session wouldn't have been complete. And I hope you all have a wonderful day ahead. So thank you. And
Thank you.
yes,
Thank you.
have a great day.
Have a great day.
Thank you.